Yeah, so TRANSCEND-CLL is a clinical trial, phase 1/2 clinical trial involving liso-cel CAR T cells in CLL. And this is a study of relapsed patients who have had prior BTK inhibitor therapy and then 2 or 3 other prior lines of therapy and then relapsed. We know that, in the current era, people who relapse after BTK inhibitors and venetoclax have fewer treatment options, in standard of care setting. And so we're wondering if CAR T cells can fill that gap. And in our study, we actually saw that out of 100 plus patients who got liso-cel CAR T cells, we had the primary endpoint was met at 18% of complete remission rates. Our null hypothesis was less than or equal to 5%, so it was pretty statistically significantly positive. And then we also saw very deep remissions in terms of minimal residual disease being undetectable in approximately 60% patients. All these responses happened very quickly, about a month after CAR T cells. And I'm still following patients who are now like 5 years out without relapsing, but the median progression-free survival has been about 35, 36 months, which is great for people who failed many novel lines of therapy. The median prior lines of therapy was 5 on this trial, so fairly refractory patients. They get 1 dose of CAR T cells, and for almost 3 years they don't need anything else. So I think that's pretty clinically beneficial in this patient population, and reasonably well tolerated. There were some CRS and neurotoxicity events, but really not a lot of grade 3 or higher events, all manageable. So very good option for patients who have relapsed many times with their CLL. No, and it can't be, because in aggressive lymphoma, your goal is cure, and it is a curable disease, although even those patients are multiply refractory. So for CAR T cells to provide a 45% chance of cure for aggressive lymphoma, it was brilliant, because these people were all going to die otherwise. In CLL, which is an indolent lymphoma, it's not a curable disease at baseline. Like historically, it's not a curable disease. So we're trying to push that bar and trying to get to cures. And so with CAR T cells, there were 2 patients, who got the University of Pennsylvania CAR T cells more than 10 years ago and didn't relapse more than 10 years later. So we think maybe they were cured. And so that's sort of proof of concept. With this trial, I have patients now 5 years out who haven't relapsed. If they go more than 10 years, could they be cured? I mean, there might be a certain fraction of people we might help in that sense, but everybody's not gonna be cured, So it's just a start. I think the next sort of iteration of CAR T trials in CLL might look at combinations or using it earlier instead of waiting for after 5 lines of therapy, use it earlier. Maybe you'll cure more people. So I think it's evolving.